Mukuru kwa Ruben, an informal settlement in the heart of Nairobi's industrial zone, is home to over 10,000 people. Settlements like these account for 60% of Nairobi's population. The people of Mukuru have no legal rights to the land they live on. As a result, it lacks even the most basic infrastructure and public services. Perhaps the most striking problem to outsiders is the water and sanitation situation.
My name is Jacob. I've been here in this village for over 20 years now. The village has changed dramatically because let's say at that time there were very few structures compared to the many we have now. Because according to our estimation here, we have more than 1,000 structures presently. And at that time we had no schools, we had no churches, security was very poor, and people had to live in fear because of being attacked at night by thugs. There are many things that should be done in Koruben so as to address some of these problems. The problem is with the community is that it has no money.
Vendetta runs a small shop selling porridge. She is also secretary of the Mukuru Residents Environment Group. Environmental conditions are the root of many health problems in Mukuru, ranging from sickness and diarrhea to typhoid and malaria. There are just 30 public latrines operated on a pay-per-go basis, and not everybody can afford to use them.
We are involved in weekly cleanups where we collectively burn the rubbish and then we unblock the drainages and also clear some of the garbage from the drainages.
Water supply is one of the biggest problems here because Nairobi City Council's piped water network does not extend to Mukuru. The only access to water for domestic and productive uses is through water vendors. Gaining access to sufficient water for basic needs is a challenge in itself, but water is also required for a wide range of productive uses at household level. Richard Mugaga keeps a small farm in the heart of Mukuru, raising livestock and producing dairy products for market. Livestock is an important source of both food and non-food income in urban areas.
I buy my water for the animals from the water vendors. The cost is normally the same for me who is keeping animals. It's the same as for the person who is using the water for household use.
Nearby, Daniel Matisia runs a small business making shampoo.
I'm making air shampoos. I am making multi-purpose detergents for washing purposes. And I am also making air conditioners. 95% of the ingredients I'm using is water. And there's a small problem because I don't have water near me.
Demand for water in areas like Mukuru is complex and related to household size as well as livelihood activities. The potential benefits of improved access extend far beyond obvious health impacts.
If I get running water, there will be a big difference because I would be buying, it will be near. You know, when you go for the water outside there, it is tiresome. And sometimes I'm working alone.
For many years, water had to be transported into Mukuru from outside. More recently, local entrepreneurs like Lucy Wanjiru have established pipe connections from the city network into the settlement.
Before even we put this sort of business of water vending, the government was there, but it had done nothing. It's we, the dwellers of Mukuru kwa Ruben, who came together and started this sort of business. So we are not depending on the government, we are depending on ourselves.
But there are a number of problems with these connections. The cheap plastic pipes burst regularly, especially during the wet season, and supplies are often cut off during water rationing.
I've no guarantee about my water source since some of the water pipes are actually under the drainage, and so there's some bit of contamination. but I still sell it anyway. So this is where I earn my source of livelihood, and I have very many dependents. So if there are some interventions, I would lose my business, and very many people depend on it.
The National Poverty Eradication Plan calls for 8% increment every year in the number of people with access to water. Now, in a case like Nairobi, where the population is almost 2 million, this is almost 160,000 people per year with increased access. This requires enormous resources. We have a new law that was passed by Parliament very recently, less than 2 months ago. And what it looks for is a total change, overhaul, especially in the institutional framework for service delivery.
The policy and the new Water Act encourages involvement of the private sector in management of water and sanitation services. However, area like Mukuru is not commercially viable to private sector involvement.
Part of the reform process, I would say, is really to bring on board, to mainstream the entrepreneurial spirit that is really displayed in these areas. These people are able to provide the services where organized institutions such as the councils and government and so on have had problems because of the interface, because of the kind of contracts that are required.
But supporting and regulating small-scale independent operators is not an easy task. Setting appropriate tariff levels and structures will depend on understanding the complex nature of demand for water in Mukuru and other urban areas.